Can you use the Medicare CQMs and the MIPS CQMs in the quality submission for ACOs?
Yes, you can, Laura. Your submission, at least for 2024, can be any combination of MIPS CQMs, Medicare CQMs, and ECQMs. They can even be duplicative. You could submit all three measures all three ways. Medicare will give you credit for the best score found in your redundant submissions. Now, Laura, Medicare intends to provide practices with a list of patients. They'll provide the list quarterly, and it lists every patient that they've seen from Medicare's claims stash who might qualify for inclusion in Medicare CQMs. Are you able to use that list to generate the submission? Do you want to? What are the pros and cons of that list?
Yeah, the list has been a great resource for a couple of our clients. Again, the challenge for the Medicare CQMs is identifying all the correct payers so that we can do the filtering on our end. And that's been a challenge. ACOs, of course, can have across that entire enterprise thousands of different payer codes. And so one of the challenges to ACOs who want to report the Medicare CQMs is collecting all of that payer data and correctly organizing by Medicare and non-Medicare. So once you're doing that, you want to validate, do we have the right population? Is this the right size of Medicare population that we should expect to report on? And the CMS is providing that quarterly file now, new for the claims data for the ACO Medicare CQMs. And the nice thing about that file is it helps us validate the size of these populations. In a couple of instances, we've helped our clients understand that they were underreporting, sometimes significantly, the size of their Medicare population. So that helped them find some gaps in the reporting and the way they were collecting claims and submitting the claims data for us to calculate those denominators. So it's been really helpful as a reference tool. I know there's some mentions in the rules about using the claims files for these Medicare CQMs as actually the denominator file. And we tend to prefer not to do that for a variety of reasons. The claims data allows us to further validate that we can also report the all-payer, all-patient version that's also available to ACOs. And so they've got two options, and if they want to look at both options, it's a great way to allow them to look at both of these options with the filtering. But there have been some challenges by collecting all of that payer data. The other issue that we would see with using the CMS file as a source of creating a denominator is that those files come very late. So the real challenge to using the claim files from CMS as a source for the denominator for the Medicare CQMs is the delay in getting those files. The final file isn't available until February, so that's very late to sort of look at your fourth quarter data. But even throughout the year, those files are not available until kind of the start of the next quarter. So using the claims files from CMS to construct a denominator for the Medicare CQMs is problematic in that way. But it's a great resource for helping us validate that we've got the right size of populations.